My name is AJ. I'm a paramedic in the state of Virginia. I've been working in EMS for about 7 years now. I put together a little something for the public to talk about the coronavirus, aka COVID-19, that is currently affecting the United States. Right now, first off, I want to start with what the coronavirus is. Coronavirus is a family of viruses that causes a variety of symptoms with a range of severity, some very mild to some very severe and life-threatening. The current one that we have is a strain called COVID-19, affectionately, where COVID-19 stands for Coronavirus Disease 2019. Transmission of COVID-19 is a droplet precaution. That means that this goes person to person and it spreads through these very tiny particles that we breathe out, cough, or sneeze. Transmission is thus easiest when you're in contact with someone who is symptomatically ill with COVID-19. When you're exposed to these droplets, it usually means that someone has sneezed or coughed or touched their mouth and they come in contact with you. A lot of times, if you're not in the direct range, which CDC says that the safe range is greater than 6 feet away from somebody who is sick, though preferably far, far away from someone who is sick. But if not getting it from the person themselves, the next easiest way for you to contract this is by contacting exposed surfaces and objects. This is to say that these surfaces have been exposed to droplets infected with coronavirus. So someone has probably coughed in their hand and then touched a flat surface, and thus that surface contains the virus. Viruses and germs can survive on surfaces for sometimes several hours to sometimes several days, depending on what the surface is and what the environment it's in. So easiest assumption, assume everything is dirty. The symptoms of COVID-19 can vary. Most people who are healthy are only going to have very mild symptoms. Sometimes this can imitate the common cold. We're getting coronavirus at a very rough time because we're also about to go into allergy season, and scientists have already told us that allergy season this year is going to be really severe with high levels of pollen. And COVID-19 can imitate just your regular old seasonal allergies if you're really healthy and you get the mildest version of it. But the issue is that for 1 in 6 people who are immunocompromised or high-risk population, aka are elderly, or people who have comorbidities, other underlying diseases, or previous lung damage or lung-related illnesses, these people are going to be more likely to get the severe symptoms of COVID-19. COVID-19's severe symptoms are intense respiratory illness and distress. Sorry, I lost my place. Thankfully, at least children and healthy adults are more likely to overcome this with no problem. When you are experiencing these respiratory symptoms, so things like difficulty breathing, harsh cough, and respiratory-based chest pain, along with the fever and other flu-like symptoms, can occur. Anytime you develop a high-grade fever, you should seek out a doctor about being tested and treated, whether it's for the flu or COVID-19. A fever is your body's way of responding, often to an invading pathogen. So, high fever, get checked out and get tested. Also, if you have any severe respiratory symptoms, right now, the big thing we're trying to tell people to do is that if you have mild symptoms, stay home, self-quarantine, take 14 days or until you're asymptomatic for several days and a doctor has cleared you, to stay home, treat yourself. There is no cure and there is no vaccine for COVID-19. The best thing you can do if you're healthy and you have a mild case of it, or even just a kind of moderate, treatable at home case, go home, Tylenol for your fever, take some Dayquil, NyQuil, treat your symptoms, and then stay away from other people. You don't want to spread it, and when you are symptomatic, you are most infectious to other people. If you start developing symptoms like difficulty breathing, chest pain, uncontrolled fever, lightheadedness, or confusion, these are the times that you want to actually go to the emergency room or urgent care. The biggest thing I'll tell you that would help us out, me being a healthcare provider in the healthcare system, is that if you need anything right now and you think you might have COVID-19 or the flu, call ahead. Now, if you're having mild to moderate symptoms and you want to get tested, call your doctor ahead and let him know that you think you might have COVID-19. Call your urgent care. Let her know that you think you might have COVID-19, you want to get treated or tested, and that you're going to come in for a visit. This allows your healthcare providers to prepare, mask up, maybe even have you come in through an alternate entrance so that way you don't potentially expose people who are in the waiting room of an urgent care clinic or a doctor's office that are waiting to get treated for something else altogether. Even if you have to call 911, let the dispatcher know that with your symptoms, you think you might have COVID-19, and that way even the medics and EMTs and firefighters, all your first responders, can be masked up and gloved and know that, when they come in contact with you, you may be potentially infectious. The best way you can combat a major viral outbreak like this one is to practice clean habits and good hand washing. I know that you guys have heard it a ton of times, so I'll tell you again. Hand washing, hand washing, hand washing. And I will get to exactly how to hand wash here in a minute. Some other things you can do, I'm going to list them out. Avoid traveling unless you're seeking medical care or going to get groceries. Avoid major public areas, big concerts, colleges, packed schools, sports stadiums. Avoid those big areas packed with a bunch of different people. Avoid public transportation, and this includes ride sharing, your Lyfts, your Ubers. You don't know how often people are cleaning their cars, and if the person that rode before you possibly was contaminated. Avoid close contact. As I said earlier, CDC defines this as 6 feet or 2 meters for any prolonged period of time. If you're not washing your hands, use hand sanitizer. Avoid touching your face. This one's the hardest one for everyone. Don't share personal items. Disinfect items in a shared household. And disinfect high-touch items and places. The nastiest thing on your person is probably the nastiest thing in this room, and that's your cell phone. Clean your cell phone case. Wipe your screen with lens-safe wipes. Wallets, doorknobs, countertops. Debit cards are very nasty, and you want to clean those. Cash is awful dirty, and you can't really clean that, so wash your hands after you touch money. When you are hand sanitizing, you want to make sure that the hand sanitizer you're using is 60 to 95% alcohol content. And if your hands are visibly dirty, you want to wash them. I'm going to have Carrie come over, and I'm going to show some hand washing skills. All right. So when you're washing your hands, what you want to do is, I'm going to pretend we're in a public restroom. You want to rinse your hands first, get them nice and wet, and then put the soap in your hands and create a lather. Now, after you've lathered your hands really good, lots of soap suds, you're going to start cleaning. For us in the healthcare field, we start with the wrists and go high because we touch everything, all kinds of awful. Now, afterwards, we'll take our hands, we'll clean like this, get our fingers and get our palms nice and good. Then we're going to clean between our fingers, both hands, and then flip both hands. And then you'll also take your fingers and curve them a little bit, scrub your palms. This helps get your fingertips and under your nails. Same on the other side. And then we often forget about cleaning our thumb in detail, so we clean our thumb really well. And I always take the end of my hand washing to sit and kind of rub under my fingernails because all kinds of gunk and stuff likes to gather there. So when you're done, tilt your hands downward, that way you don't splash stuff up your arms. Rinse really well. And then most stuff is like hands-free, so you can pull a paper towel dry, and then take the paper towel that you have and cut the water off. Dispose of it immediately. So, other tips when you're trying to do good hand hygiene is when you're in a public bathroom, most public places have the doorknobs that you can like put your elbow on it and open your door. Same with push doors. You don't have to use your hands. Push them open in other ways. Cleaning your house. Please disinfect and clean your house. It does not take 25 boxes of Lysol and Clorox wipes, but disinfect your high-touch areas. The other thing is that when you're using a disinfectant that is wet, you need to let it dry. And I mean completely, especially with wipes. People don't quite get this a lot, but if you're using a saturated cleaning wipe, after you wipe that surface, leave it alone until it is fully dried. That way it has had plenty of time to work. If you're ever questioning a cleaning product, read the directions and it will tell you exactly what to do, exactly how to do it. Some do-nots, and I hate to say that I have to tell people these do-nots, but I have to tell some people these do-nots. Don't ingest bleach or disinfectant in an attempt to clean your mouth or mucous membranes. That is not smart. I saw that in the news recently. The other thing that's huge is don't avoid these safe practices in hand hygiene just because you have a strong immune system. Even if you think COVID-19 isn't going to hurt you, the reason we are trying to establish these safe guidelines and prevention measures is to protect the people around us that are vulnerable. That 1 in 6 that is going to get this severe illness, that's our immunocompromised and our elderly, people who have pre-existing respiratory illnesses. And we're trying to protect these people. So if you don't take preventative measures, despite being a healthy young adult, the consequence is that maybe your coworker who is immunocompromised is going to get it from you and they're going to have serious side effects. Or a grandparent maybe. It could be someone you don't even know that catches it from you. What we're doing with prevention and mitigation is protecting everyone, and it is everyone's responsibility to take this into key. If you get sick with COVID-19, I've already talked to you about staying home and taking care of yourself, but stay away from others, disinfect and clean up after yourself, cover your cough and sneeze, preferably with a tissue, and then dispose of that tissue immediately and wash your hands. Face masks are for the sick and for first responders. If you are sick, a surgical face mask is capable of catching droplets that come out of your mouth or nose and preventing them from going through the air and affecting other people. Face masks are not the greatest at protecting a healthy person because they've got these big gaps inside and over the nose. They're good for catching stuff coming out of your own face. If you're healthy and you're using a face mask, the only reason should be that you are in very close contact with someone who is sick. Say you are the caretaker for someone who has COVID-19 or another droplet transmission type illness. Do not share personal items, especially those that have come in contact with mucous membranes or hands, aka food, kitchen utensils, chapstick, you get it. I've already told you guys, call ahead. Calling ahead and letting people know that you're coming, especially if you think you've got COVID-19, is a great way to help protect other people. And if you are confirmed to have COVID-19 and you are quarantining yourself at home and treating it at home, when you have been asymptomatic, you haven't had any symptoms for several days, you have no fever without taking medicine. I'm speaking of you're off the Tylenol, no Dayquil, NyQuil, and you still have no fever, call your physician. Your physician will probably have you take another coronavirus test to see if it comes up negative, or they will discuss how you're feeling and how you're presenting and how long you've been in quarantine to let you know if they feel it is safe, their professional medical opinion, if they feel it is safe for you to leave the house and be back in the public COVID-19 free. The big thing about COVID-19 currently is that there is no cure and there is no vaccine. Treatment is strictly supportive care. For those who have very serious cases of COVID-19, this supportive care can be ventilators, respiratory therapy, so on and so forth. And that's why we talk about the curve, aka the graph of overwhelming the hospital system and our healthcare resources in America if everyone gets sick all of a sudden. That's why we're trying to slow the curve. I'm going to reiterate one last time. If you start having severe symptoms, aka difficulty breathing, chest pain, uncontrollable fever, lightheadedness, confusion, you feel like your heart's racing, you feel like just absolute death and it's more than just fatigue, call 911. Let them know that you're having these symptoms and go to the hospital. Or if you're going to go to the hospital yourself, call the hospital ahead of time. Let them know you're coming. If you are having these severe symptoms, please go to the emergency room and get taken care of. But if you are not having severe symptoms, try and stay home, do virtual physician visits, walk-in clinics, your primary care doctor. Let them know ahead of time and get better. But all in all, the biggest thing is try and prevent the spread of this, not just for yourself, but for others as well. All of this information has been prepared on March 14th of 2020 with resources used by CDC and the World Health Organization. If you guys have any questions or need anything, you can feel free to ask me in a few minutes. My best recommendation as far as getting facts and resources is if you see something on the news and it sounds wild, double check with CDC and the World Health Organization. These are two fact-based, science-driven, up-to-date places where you can get some of the clearest instructions on what is the coronavirus and how to take care of it. My name is AJ and it's been a pleasure.